congenital diaphragmatic hernia is a situation where the baby or the fetus doesn't develop the muscle that separates the lungs from the abdominal compartment, which contains bowels and liver and stuff. And when that muscle doesn't develop, some of those organs that are in the abdomen, like bowels and liver, can end up in the chest, and that makes less room for the lungs to develop. So when these babies are born, they have very small lungs, and it makes them very difficult to breathe. So there's a big spectrum of diaphragmatic hernia, but in essence, that's the problem. So the Advanced Fetal Care Center provides a very unique service for families who have congenital diaphragmatic hernia. We are one of the premier centers taking care of diaphragmatic hernias, really have quite good outcomes. And once we refine the diagnosis and can risk stratify the fetus, figure out if it has a syndrome or not, we can accurately counsel the mom on the trajectory or the course of events for that fetus through gestation. We can then plan the delivery time, mode, location, and method. All of that can be planned. And then once the baby's born, the baby will go up into our intensive care unit in 7 South, which is really quite specialized to take care of diaphragmatic hernias. That's one of its major focuses. And there we have a very specialized team of all the specialists you can think of that take care of that baby, from respiratory therapists to intensivists to surgeons, nurses. The baby will go through that course depending on its severity, which at some point will involve 1 or more operations. We also work very closely with our cardiologists because one of the consequences of diaphragmatic hernia, having these little tiny lungs, is that they act like little tiny oil filters in a motor. They don't pass a lot of blood, and therefore the pressure builds up behind the lungs, and that affects the heart. We call that pulmonary hypertension, high blood pressure in the lungs, and that affects the heart, and therefore we have to have our cardiologists involved. And they're involved very intimately, often on a very daily basis or more often, and they markedly affect the outcome of our babies.